Welcome to Quick Trivia. Today, we'll be testing your knowledge of the USPSTF screening guidelines. This will be especially relevant for review before Family Medicine Shelf and Step 2 CK. Get ready to answer questions and test your knowledge. Before we get into trivia, I want to briefly go over the USPSTF grading scale for the different recommendations and how strong these recommendations are. Sometimes questions will allude to these grades, so it's good to be generally familiar with what they are and what different grades mean. So there are grades A through D, where A is strongly recommended and D is not recommended. And then B and C are in between. So the bottom line is that grade A and B recommendations are offered to patients, whereas C is offered to select patients based on a discussion of risks and benefits and shared decision making, whereas D is not recommended and not offered to patients. So let's go through the must-know screening guidelines, starting with abdominal aortic aneurysm. Who should be screened for AAA? Men 65 to 75 who have ever smoked. And how do we define if somebody has ever smoked? At least 100 cigarettes in their lifetime. How do we screen for AAA? With a one-time abdominal ultrasound. Who should be screened for breast cancer? Women aged 40 to 74. And how do we screen and how often? Mammography every 2 years. At what age should screening for cervical cancer begin? Age 21. And what is the frequency at which we should be screening and how do we screen? For ages 21 to 29, patients should have a pap smear every 3 years. Then, ages 30 to 65, patients can either every 3 years get a pap smear or every 5 years get high-risk HPV or co-testing with pap smear and high-risk HPV. Who should be screened for colorectal cancer? Adults aged 45 to 75. And how do we screen? What are two common modalities and how often must those screening tests be repeated? You can do colonoscopy every 10 years, or you can do DNA FIT every 1 to 3 years. Cologuard is an example of a DNA FIT test, which is repeated every 3 years. Of note, this age range of 45 to 75 includes two different grades of recommendation. Grade A, which is a strong recommendation, is used for ages 50 to 75, and grade B recommendation is used for 45 to 49. In clinic, you will see patients who continue to get screening beyond age 75, and that is because there's a grade C recommendation up to age 85. Many of the questions that I have seen on board exams focus on when to start colorectal cancer screening, which is age 45. Another common question or point of learning is around first-degree relatives with colorectal cancer. So if a patient does have a first-degree relative with colorectal cancer, when should screening start and how is it changed? Screening for these patients should start at age 40 or 10 years before the earliest diagnosis of the family member, whichever comes first. And screening should be repeated every 5 years instead of every 10 years. Who should be screened for lung cancer? Adults aged 50 to 80 with at least a 20-pack year history who either currently smoke or who have quit within the last 15 years. How do we screen and how often do we screen these patients? With an annual low-dose CT. Who should be screened for ovarian cancer? Trick question, screening is not recommended for asymptomatic women who are not known to have a high-risk hereditary cancer syndrome. This is designated as a grade D recommendation by the USPSTF, meaning that we do not offer screening for ovarian cancer to these patients. Of note, if a patient has a family member, a first or second degree relative with ovarian cancer, the next best step is to pursue genetic testing, not screening testing or screening imaging for ovarian cancer. Who should be screened for prostate cancer? For individuals aged 55 to 69, there is a grade C recommendation, meaning that patients can have a risk-benefit discussion and have shared decision-making with their clinician on whether or not to screen. How do we screen for prostate cancer? With prostate-specific antigen or PSA. Who should be screened for osteoporosis? Women aged 65 and up, or postmenopausal women less than 65 who are at increased risk. So what are some of those risk factors that may make us screen somebody younger than 65? Some common ones are a parental history of hip fracture, current smoking, excessive alcohol consumption, which is defined as at least 3 drinks per day, or low body weight, which is less than 127 pounds, or BMI less than 20. How do we screen for osteoporosis? With a DEXA scan. Who should be screened for chlamydia and gonorrhea? All sexually active women less than age 24 and women 25 plus who are at increased risk. Depression screening should begin at age 12. You can use validated questionnaires such as the PHQ-2 or the Geriatric Depression Scale. Anxiety screening should begin at age 8. Again, you can use validated questionnaires such as the GAD-2. Who should be screened for intimate partner violence? All women of reproductive age, and this includes those who are pregnant and postpartum. And that concludes our review of must-know screening guidelines. Let me know in the comments below what you'd like to see next.